Okay, dear students, how do you remember the causes of reversible dementia with the mnemonic dementia? D stands for drugs, especially benzodiazepines, which can be very commonly abused. E would stand for endocrinological causes, and these include hypothyroidism, hypo or hyperparathyroidism, and hypo or hypercortisolism. So, both Cushing's disease and Cushing's syndrome as well as Addison's disease can lead to dementia. M is metabolic causes. Primarily, we are concerned about nutrient deficiencies like thiamine deficiency, niacin deficiency, which is pellagra, of course. Thiamine deficiency will lead to beriberi. Dry beriberi can lead to dementia, which is reversible to an extent till Wernicke's encephalopathy. Correct? And B12 deficiency all can contribute to development of dementia. E, the other E stands for eyes and ear defects. So these are not true causes of dementia. Instead, they are pseudo-dementia. Pseudo-dementia could also be because of depression. Please remember. N stands for NPH. T stands for trauma in the form of SDH or toxins like alcohol and lead poisoning. I stands for infections like HIV, syphilis, as well as Whipple's disease. A stands for autoimmune encephalitis. So with this, you should be able to remember the reversible causes of dementia.